Next, I'd like to talk about our Pediatric Developmental Panel. It has some very significant markers on it. Many people who've done a lot of research think that methylation or MTHFR, there are two MTHFR genes. A person can have a significant methylation deficiency and not even have those genetics. But what lies at the root cause of many things that pause development in children or cause a child to be more vulnerable to a vaccine injury or to regress in their speech, their mentation, their gross and fine motor function has to do with inflammation and autophagy. This panel is a great way to tell if your child is going to be more vulnerable to possible vaccine injury. There are so many factors that involved, but the one thing, or a few things that we can tell from this developmental panel is, does your child have impaired autophagy, the ability to clean out the cellular debris, to recycle the good stuff and kick out the bad stuff, and also if your child has unchecked inflammation. So many parents say that, well, my kiddo was saying mama and dada, crawling, moving, up until the time they had their varicella vaccine, their chickenpox vaccine at a year of age, or their MMR at 18 months of age. And what's significant about those is that they are partial live virus vaccines, and the body should normally respond by making antibodies to those vaccines. But what if it stops, halts their developmental progression, or they regress? And that is a story I hear almost every week in my office. Contrary to what is in mainstream media, I have numerous patients, children, that is their story. And I also have children that never received vaccinations and have not developed appropriately. And if that's the case, if they have impaired autophagy or inflammatory markers, and it may be some things that occurred during mom's pregnancy, things that she ingested, things that she was exposed to, how the child was nourished after they were born, all these factors are part of it. But the thing is, if you can identify these things to prevent ongoing unchecked inflammation in your child, or to help them with autophagy to get rid of the cellular debris, that is going to be so beneficial for them. So this particular developmental panel has neurotransmitter markers on it. It also has a sugar marker on it to tell us if your child is specifically prone genetically to becoming hyperactive if they ingest refined sugar. And also if for some reason they were prescribed antipsychotic medications when they're older, if they would be more prone to profound weight gain. This panel, in addition to neurotransmitter markers, that sugar marker also has inflammatory markers, detoxification markers, and the autophagy markers. So if we can identify the inflammatory and autophagy detoxification markers, dial the inflammation down in your child, and determine if they would be less vulnerable to any issues with the addition of vaccines, that's what we want to do. Why have it done? The developmental panel is a cheek swab. It's specifically for children and individuals that want to know if they have vulnerability to vaccine injury, if they have unchecked inflammation in their body, and as a child, if that child is struggling with depression, ADD, ADHD, anxiety, bipolar disorder, those are the things that we're looking at. The swab is done in the office. Even if you have a breastfeeding baby, we'd request that you bring 2 clean wash rags, and we'll put some nice filtered water on it, clean the inside of your child's mouth out so that there won't be any residue from breast milk, so that we wouldn't have maternal contamination of the baby's DNA. Get a cheek swab, and it takes 2 to 3 weeks for the results to come back. These genetic tests will never change. Based on those results, we'll decide what vulnerabilities may be present in your child and how we can address those with supplementation and/or medications. Whenever I prescribe medications, which is rarely, I do that to decrease inflammation, improve the body's ability to clean out the cellular debris, recycle the good stuff, get rid of the bad stuff, and to promote healing.